stopped at TNM classification last week. So this is where we stopped. All right, so let's begin with cancer etiology and genetic risk.
What page is that, Professor?
All right, we are on page 377. Okay, briefly, let's discuss protogenes and suppressor genes. Now, in the normal cell, if you remember a comparison last week where there was a table where we compared a normal cell, a malignant cell, and a benign tumor cell. Okay, one of the characteristics is normal cells have a predetermined lifespan, meaning after a certain time, a cell dies. Okay, so a cell has a predetermined um, lifespan. Okay, so for a lack of a better description, these protogenes and suppressor genes, compare it, the way cancer.org describes these two genes is we have a gas pedal. So the gas pedal is referring to the proto-oncogenes, whereas the suppressor genes refers to the brake pedal of a car. So to help a cell grow and divide, we need the proto-oncogene, meaning these are not technically abnormal cells. Okay, they are part of your genetic makeup. They in fact are helpful because they help you grow, help your cells grow. However, there will come a point in some time in our life, particularly when exposed to carcinogens, for instance, like right here, which is described here. So when we are exposed to any carcinogen, or let's say let's say we got old, because later when we get to the risk factors, age or advancing age is one of the single most highest risk factor for the development of cancer. We grow old, some of our cells mutate. So it is when these proto-oncogenes mutate, they become oncogenes now. So and if at the same time the suppressor genes, which is supposed to be the brake pedal, which will in a way stop the cells from overgrowing, if there is an imbalance between the two, namely you have oncogene activation, meaning the proto-oncogene, which was supposed to be normal, mutates, becomes an oncogene, plus at the same time your suppressor genes also are turned off in a way. Okay, turned off, quote unquote, meaning they cannot do their job very well. So these two conditions are a perfect environment for the development of cancer. How exactly, we don't know. Okay, we just postulate that when exposed to carcinogens, some of our cells DNA, mainly our genes, the oncogenes and the suppressor genes, stop working normally, and then they promote the growth of cancer cells now. So let's go to external factors. So we did the internal factors. So we are referring to the protogenes, which now become oncogenes, and then your suppressor genes stop working or stop doing their job. External factors, we have several. We have chemicals found not only in food, but also in our drugs that we take, things we are exposed to every day. Number one of which is tobacco. Please know that tobacco is not only related to lung cancer. As stated here, cigarette smoking has been linked to more than just lung cancer. It can develop into pancreatic, oral, laryngeal, bladder, or even cervical cancers, all linked to tobacco. Others are radiation. So this radiation here can be from the sun. For those who worship the sun, like sunbathing, summer's coming, um, part of our health promotion and actually primary prevention for cancer, which is the last topic of the chapter, is of course protecting from the radiation coming from the sun. We also have radiation from not only therapeutic radiation, meaning the radiation therapy we use to treat cancer can also lead to, potentially lead to other forms of cancer. We also have radiation from industrial sources. So, let's say you work in a nuclear power plant, for instance, or let's say you are involved in weapons manufacturing, like in North Korea, for instance. We also have viruses that will lead to cancer. Um, Table 21-6 tells you, I mean, enumerates the known viruses that have been linked to cancer. Most notable are Hep B and HPV. So therefore, these are absolutely preventable cancers. So therefore, when you vaccinate against Hep B, you are essentially protecting yourself from liver cancer. And the same thing for HPV. So our tweens and teenagers, for instance, can be protected from these cancers right here. Okay, they're not minor. I mean, these are vulvar cancers, cancer of the penis, as well as anal cancer. Diet plays a major role in cancer development. So, high fat diet, especially high intake of red meat. Okay, I'd like to emphasize high intake. So, moderate intake is not, that bad. And also with um, processed foods now, wherein we have dyes, flavorings, or other preservatives, for instance, that we add to our food. And part of our prevention is chart 21-1. These are dietary habits to reduce cancer risk. It's not rocket science. I mean, these things our mom possibly already mentioned to us, right? Telling us to, eat right. Not that we follow it necessarily. If you remember from chapter 36 under DASH diet, so here's moderate alcohol intake again. So eat more fiber or bran, eat more vegetables and fruits. Okay, so again, things your mom already told you. Other factors are immunity. We know that our lymphocytes, particularly natural killer cells or NK cells, these are types of T lymphocytes, are responsible for killing cancer cells. So this explains why a patient who develops AIDS, for instance, from HIV, develop Kaposi sarcoma because they are their immune system is completely trashed. So therefore, they cannot protect themselves from the weakest cold virus. So much more from how much more against cancer cells. We also have related to decreased immunity, immunosuppressive drugs. If you remember from chapter 17, which we tested for exam one of the complications after taking the Cytac and the Cycmias drugs, one of them was malignancies, if you remember. So they can increase your risk for the development of cancer. And we already mentioned AIDS. Here is what I mentioned earlier. Advancing age is the single most important risk factor for cancer. So as we grow old, our risk for cancer increases. Table 21-7 is the oldest acronym for the 7 warning signs of cancer. Um, During my time, probably from my parents' time, uh, probably way beyond that. Caution are the most common warning signs for cancer. This is self-explanatory. Let's say changes in bowel or bladder habits. So of course that would indicate possibly colorectal cancer or even bladder cancer. A sore that doesn't heal really depends on where is the sore. The sore could be in your mouth. It could be on your skin. In your mouth, then that's oral cancer. If the sore is on your skin, that could be melanoma. The sore is on your nipple, for instance, then that could be breast cancer. Unusual bleeding or discharge, again, depends where the bleeding is. Bleeding could be in your nose, um, through your GI tract, for instance, or your ears, or coming out of your urine. Okay, so it really depends where is the unusual bleeding. P is for thickening of the lump in the breast or elsewhere. So if it's on the breast, of course, that could potentially be breast cancer. And the lump could also grow somewhere else, like around the neck, for instance. That could indicate lung or bronchial cancer. Or if it's right around your jaw, that may indicate um, not only oral cancer, but it could also be laryngeal cancer. Indigestion or difficulty swallowing, so this would be throat or laryngeal cancer, or it could be esophageal cancer. Obvious change in a wart or mole, so that obviously is a melanoma. And then nagging cough or hoarseness could be lung cancer or tracheobronchial cancer. Please read chart 21-2 on your own. Again, it's kind of the same, but since the advancing age is the single most important risk factor for cancer, so that's why we have special focus on the older adult. So these are, again, they mimic caution, but these are more specific. So let's say under colorectal cancer, these are your assessment questions. So this would be a very nice select all and apply question. So let's say I'll go, you have a 78-year-old patient, which patient complaints or patient, um, either the patient reported it, or it could be which assessment questions would a nurse ask about. Okay, so these are specific to each cancer. I mean, they're not that difficult. So of course, let's say colorectal cancer, of course you will, as we go to cancer.org toward the end of the chapter, um, you'll see that stool testing, for instance, blood testing of the stool, no, sorry, testing for blood in the stool is one of the most common testing. We used to have colonoscopies as the recommendation, but cancer.org has since recommended that stool-based testing is just as effective. Of course, if the blood in the stool testing is positive, then they will recommend a colonoscopy. Please read the rest. I'm not testing 21-8. These are lists of cancers who have a genetic predisposition. I really don't have questions on that. Okay, so this part here, genetic testing are options. However, take note that genetic testing do not diagnose the presence of cancer. They only provide risk information. So before a patient may decide to do this, think of the implication though for the family, because so let's say you test positive in the genetic testing for you have a cancer predisposition. Again, this does not mean you have cancer. However, it does provide that you have the risk for cancer. Now, consider the effect on this on not only you, but on the family, specifically on your psychological impact. Okay, so this would add worry, for instance, although that's one way of looking at it. Another way of looking at it really is the more positive way, meaning you know that you have the genetic disposition, then maybe that will encourage you to take care of yourself better, do primary and secondary prevention screening, for instance, or to adopt a more healthy lifestyle. Okay, so there's two ways around it, but again, it's a double-edged sword. So one way it can, encourage you to take action, but in another way, it may cause you um, a lot of worry, may cause depression. And another thing is, even if you test positive for a gene mutation, um, does not guarantee that you will actually develop cancer. Any questions so far before I go on?
No.
This is the last part of this chapter. So we have two types of prevention here. We have primary versus secondary. Thank you for reading. Primary, Ms. Limas.
Hold on. I can't find it. Oh, okay. Primary prevention is the use of strategies to prevent the actual occurrence of cancer. This type of cancer prevention is most effective when there is a known cause for a cancer type.
Okay, and the examples are here. We have a lot of activities here, but generally speaking, when we say primary prevention, this involves avoidance of known or potential carcinogens, meaning this is even before you have the risk for cancer. For instance, uh, avoiding smoking, or if you're already a smoker, then stop smoking, for instance, eating healthy, avoiding exposure to asbestos, for instance. Others are, let's say, alcohol, so you lessen your alcohol intake. Others are, let's say, here during a routine colonoscopy, for instance, unrelated to cancer. So let's say we just had because you had some bleeding episode, for instance, and then the doctor, your gastroenterologist decided to look for a cause for bleeding, and then during that diagnostic procedure, they found polyps, for instance. Okay, so colon polyps are known to develop into cancer later on, so they will remove that. Okay, so that's an example of primary prevention. We also have chemo prevention, and we also have, as already mentioned earlier, we have vaccinations because, for example, Hep B and HPV have been known to cause cancer. So if you vaccinate against these, then you're saving yourself from future cancers. So I'll grab the examples from this whole section here. So I can ask you whether, which of the following are considered primary preventions of cancer. Select all that apply, or it could be secondary. In secondary prevention, this is now about screening. Screening is not part of primary prevention, although it may sound like it's primary, but secondary prevention, as you'll see here, no matter what the screening is, it's all based on age. If you look at here, for mammograms, for instance, it starts at a certain age. Colonoscopy starts at a certain age. Blood testing of the stool, as well as digital rectal examination, okay, starts at a certain age. So therefore, the patient has a risk factor now. They grow old, or they age at a certain number. However, for the exam, I won't use these because your textbook is 5 years old. It's no longer that accurate. So when you take the NCLEX, your third semester, yeah, so early next year when you take the NCLEX, remember the NCLEX uses government websites. So here is your reference. So this is American Cancer Society. So let's go to the website. So just type in cancer cancer.org. Again, I won't test this part here because this is not very accurate anymore. Again, this is probably true 5 years ago, especially this one here, age 50, that's no longer true. So if you go to cancer.org, so this is the website, click on the Stay Healthy tab, click this one, and it will open here under on the website change. All right, here, reduce your risk for cancer. And then there should be cancer screening guidelines right here, cancer screening guidelines. And then this one, American Cancer Society guidelines for early detection of cancer. So this is what I'll use for the exam. Remember last week I showed you a figure showing this figure right here, this one, cancer incidence by death and by site and gender. So here we said for females and male actually also. So the top three are breast, lung, colorectal, and we have cervical here. We'll skip the lung because really the only screening for lung cancer is a CAT scan. So that's quite simple. For the website, you'll only study the first three: breast cancer, colorectal cancer, and polyps, and then finally cervical cancer. Again, let's start from the beginning in case you missed it. So cancer.org, click on the Stay Healthy tab, and then right here, reduce your risk for cancer. Used to be I refer to pictures, but the pictures here change all the time because they update the website constantly. So go to Stay Healthy and then reduce your cancer risk. In the next page, you go to Cancer Screening Guidelines. And then finally, the first tab, which is American Cancer Society Guidelines for the Early Detection of Cancer. And which ones again am I testing? Ms. Jen Perk?
Breast cancer, colorectal, and I missed the last one, cervical.
Okay, so let's discuss this briefly before we go on a break. So breast cancer, age 40 to 44, the statement says should have the choice. So should they have to?
No. No.
Not necessarily, but if they want to, yes. Will the insurance company pay for it?
Yes.
Yes, because this is recommended by ACS. How about women aged 45 to 54? The statement changed to should get it every year. And as you notice, 55 and older, it becomes every 2 years. And screening should continue as long as a woman is in good health and expects to live 10 years or more. And yeah, that's it. Those are the guidelines. So 40 to 44, they have the choice. 45 to 54, they should get it. 55 and older, we decrease the frequency to every 2 years. That only tells you that, what can you say about breast cancer?
Chances decrease as they get older.
Yeah, so therefore, why is it every year for aged 45 to 54? So what's happening with this age here? What's happening to a woman?
Menopause.
Is that when they're, yeah.
Right, so your hormones are out of whack, so that will feed the tumors, okay? So that will feed the breast cancer more, increasing your risk. Colorectal used to be, this one said 50, clearly says here on your textbook. Your textbook still in 2015, it still said 50 years old right here, colonoscopy at 50. But now obviously the data has changed. So they've seen younger and younger people developing colorectal cancer. So they start the screening now earlier, starting at 45. This page also used to say a whole lot of guidelines on colonoscopy. But right now, what's it saying now? Does it have to be a colonoscopy?
No.
No,
A
they're just
stool
looking at
test?
the stool. Okay, so
Mhm.
current data shows now that we don't have to do an expensive colonoscopy. My last colonoscopy was, I can't even remember. Anyway, the reason why I got it was it's actually my fault. Um, when I was 23 years old, I was about to leave a job, and I just said out loud to my doctor that says, you know what, I never got to use my health insurance. I've never been sick. And then my doctor suggested, oh, why don't we do a executive, checkup, you know? And then she made up this um, diagnosis, that I had these symptoms, and then sent me for everything. So I went to the hospital and they did a EGD, they did a colonoscopy, they did uh, all kinds of ultrasounds, blood tests, and of course they didn't find anything. And then the doctor had to justify that there was a test, so I think he falsified the result, saying that I had chronic colitis, because when I had another colonoscopy uh, almost 20 years later, well, the finding was I was normal. There was no colitis, or chronic colitis doesn't just disappear. So that's how I thought, those guys were just ripping off the insurance company. Um, so here they no longer recommend necessarily a visual examination, meaning it doesn't have to be a full colonoscopy. You can start with a stool-based test, meaning if there's blood in the stool, or they can send also not just blood, stool DNA. They can also look for cancer cells there. But if it does turn positive, then they will have to take a visual. So, which is also, of course, a colonoscopy, or at least a sigmoidoscopy.
Professor, I have a question.
Yes.
What age would be the right age for the colonoscopy? Would it be 50 or 45? If
No,
that was
currently the recommendation is 45, but again, it's not necessarily a colonoscopy. They start with
okay.
a stool-based test now.
Okay.
Okay, so you can be spared with the prep, because there's a lot of prep for colonoscopies. You have to be NPO for a certain number of hours, and then you have to take these laxative cocktail. So it's such a hassle. Whereas you could just send a stool base. You don't even have to leave home. They just give you a kit and then put your stool sample in it, and they send, and then you get the results. Cervical cancer. This used to be, I remember when I went to school, the statement said all sexually active women should be tested for, should receive a pap test. So I don't know how long ago that was when I went to school. So it obviously has changed, because now they said cervical cancer screening should start at age 21. Women under age 21 should not be tested. Now, before you say, "Oh, I've had a pap smear when I was 11," well, you probably did, but that pap smear, I'm sure, wasn't done to screen you for cervical cancer. Okay, so this one says only, this is only referring to for cervical cancer screening purposes. No woman under age 21 should be tested for that. Is that clear?
I have a question.
Yes.
So why would that change from sexually active to a certain age if HPV can cause cervical cancer and isn't that an STD?
Hey, I don't know, man. This is again for cancer screening, okay? This is from cancer.org. I don't know what the research from American Cancer Society is, but this is who the government turns to. Okay, and then their current recommendation is for cervical cancer screening purposes. When should testing be done?
21.
At age 21. Again, if for other reasons you need a pap test, then so be it. But I'm sure that test, if your doctor ordered it, that was not done for cervical cancer testing purposes. Is that clear?
Copy.
All right.
Professor, what if you're
Yes.
if you have an increased risk of getting a certain kind of cancer? Like, does the ages change then, and then would like insurance cover it?
Okay, well, that one is now different because the doctor obviously sees that you have the symptoms, then that doesn't fall under early screening. Does that make sense? So this is only for early cancer screening guidelines. Okay, so all of these we're talking about, from mammograms to stool testing for colorectal cancer and cervical cancer using a pap smear. These are only for early cancer screening guidelines.
Okay.
Of course, if you have a symptom, then we don't wait. This doesn't apply because now you have symptoms of that cancer. Then, of course, you have to be tested. Make sense?
Yep.
All right. And then please follow here women between 21 and 29 every 3, and then so on between 30 and 65, down to every 5 years, and so on. And that's it for chapter 21. Any questions?
No, sir.
All right, so let's take a short break. We'll come back at 8:45.
Okay.
Sounds good.